Welcome back, class. We're going to talk now. We've talked quite a bit about business intelligence. Now we're going to talk about health informatics and why it's important. And when I think about health informatics, I talk, I don't want to say ad nauseum, but you will hear me and you'll think that I sound like a broken record. But in the healthcare field, there is a financial coin that payers and providers are struggling over. And payers and providers, as they struggle over this coin, they try to um, develop processes, procedures, analytical expertise that's going to somehow give them a leg up or give them an advantage as they struggle for this financial coin. And I will flip flop back and forth between health informatics and healthcare informatics. I use the term somewhat interchangeably, but not only we're talking about individuals that will work either on a payer side or a provider side, but I also think about those individuals that are going to work on the policy side, public health policy, trying to, again, as the government loves to play in the, in spaces where they think there is market failure, they will try to get in and play in that sandbox. And so you've got the payer side, you've got the provider side, you've got public health, but you've also got an area, and I'll just call it private enterprise, consultants, vendors that are working both sides of that financial coin, trying to sell, healthcare, consulting services, management services, strategic planning services, analytical services to both government agencies on the public health side and also the payers and the provider side of that financial coin. So you've got a lot of individuals, I'll say, generating revenue in the healthcare space. Again, both sides of that financial coin. And when we talk about health informatics, we're talking about a discipline using, especially big data and data analytics to improve diagnosis. You go into a hospital and, you're talking about things like evidence-based medicine. You're trying to do a better job of diagnosing what is causing the patient's visit to that healthcare provider. You're talking about treatment protocols. Big data and analytics can help develop treatment protocols that, at least in theory, should drive a higher probability of reaching that, or maximizing that patient's utility function, because, it's when they're measuring utility of going to see that provider, the expectation of the consumer is, or the patient is that the provider is going to give them a treatment protocol or a treatment plan that's going to make them feel better. Cost containment, revenue streams. Again, go back to what I talked about in the first segment when we were talking about business intelligence. Profit, whether it's on the payer side or profit on the provider side, is going to be determined by revenue minus cost. And so health informatics is going to help drive not only cost management, but help drive those revenue streams on both sides of that financial coin. And not only that, but it's going to help public health, let's say, or policymakers improve their ability to develop programs that should transform healthcare goods and services and provide increased access to those healthcare goods and services for an underserved population. The association that, I don't want to say manages, but has been set up for informatics is the American Medical Informatics Association, AMIA. Health informatics is the science of using data, information, and knowledge to improve human health and the delivery of healthcare services. At least that's their definition of health informatics. And to me, I've always, I guess, I don't want to say lumped, I've always divided professionals in the health informatics field kind of into three categories. I talk about analysts to capture, analyze, and communicate. They are the data interactions. They may be the coders that are coding medical bills, and in the billing process as the bill comes from the provider to the health plan to be paid, or to the payer to be paid. And then you've got technology roles. They design and they code and they manage repositories. Here I'm talking about data warehouse, transfers of data, consolidation of data, and again, coders, but a different kind of coders. When I talk about coders more in the analytic role, or coders, and on both the payer side and the provider side, you have coders, and I'm thinking more of coders when it comes to CPT codes and HCPC codes and diagnosis codes. Those coders differ from the coders that you're going to see in technology roles, where they're actually writing code maybe in SAS or some other language, and to drive not only the access to that data, but the storage of the data and the efficient extraction of that data. And then you've got the leadership roles. You need somebody that can translate data and information, because I've had a difficult time in my career with, especially those that on the technology side of the house, and coders, especially when they're writing code to extract data. It is really difficult for them to understand the data request, to write the SAS code or the Cognos code or business objects, whichever one you use, Alteryx, Power BI, doesn't matter which coding software you're using, and generate the reports. And for them to actually to be able to analyze and explain and to translate it, again, it's almost like the desire is just not there for them to do that. And so you need somebody that can translate it. You need technical teams that can understand it, and you need somebody that can translate the information to the end user, because whether it's medical management, network management on the payer side, or whether it's those making those strategic planning decisions on the provider side, you have to have somebody that can translate that information to the end user in such a way that they can act on it, and it turns into actionable data and drives either the payer's business forward or the provider's business forward, or hopefully it drives both of them forward. When we're talking about jobs in health informatics, I'm thinking about who's going to employ them. I'm thinking, healthcare systems. I'm thinking public health, insurance companies, research, big pharma, academia. And then you're talking about, provider networks, providers. You're talking about consultants, vendors that are providing this information both on the payer side and the provider side. So the job market and the classifications for jobs in the health informatics industry is extremely broad. There are a lot of opportunities out there, and not only in the analytical side of it, the understanding of health informatics is extremely beneficial for those let's just say on the health plan side. If you're working in network management or medical management doing clinical roles, it's extremely important to understand the analytical aspect, and it's going to help it's going to help you, if you're in one of those types of functional areas, do a much better job in your position, because you understand the underlying data and you understand the information that's being provided to you. A couple of things about when we talk about health informatics. So I've kind of lumped them into some really broad categories. Now I'm going to get into some specific categories that you may. Let's say you go out to Indeed or you go to LinkedIn and you're looking for jobs. you may see some of these types of jobs pop up. You've got just, you've got health informatics, and it's just the analyst, the health informatics analyst. And now the buzzwords when it comes to the analytical aspects of health informatics, it's everybody wants to be a data scientist. Everybody wants to be an informaticist. So they've come up with these buzzwords. But again, they're looking for individuals that are competent in an analytical role that understands the underlying data, that can take the underlying data and transform it into information that either providers or payers or even public health is going to use to significantly increase the effectiveness of their strategic management processes. You've got things like evidence-based medicine. You've got individuals who are trying to help with public health decisions, with patient access. Again, it comes back to understanding, it comes back to data, to information, to knowledge, and to wisdom. And individuals that fall into this analytical type, especially in the government realm or on a consulting realm or in a payer realm, you're talking about they take big data to another level, and they do it by combining big data and medicine to analyze and inform best practices and insights that will impact the healthcare industry. That's where we tie that back to evidence-based medicine. They deal with patient data and with the electronic medical record, or now they call it the electronic health record. It requires domain knowledge. And when I say domain knowledge, it's an understanding of a specific industry, discipline, profession, activity, or field of study. And domain knowledge, when we talk about health informatics, is domain knowledge that's required by working in the healthcare field. So right now we're in module, we're in the third module. First module was the syllabus, and this is our third module. This will be the first three. This will finish up the first three modules that will be included when we take our quiz, I guess, in a couple of weeks. But when I say domain knowledge, we're going to get into the domain knowledge starting with next week, because next week we're going to start getting into the coding, start understanding types of codes and understanding how they impact healthcare in general. So this is where you're going to start picking up that domain knowledge. Any healthcare organization, public health, consulting, provider group, they're all looking for health informatics type individuals that understand the underlying data, can take that underlying data and transform it into actionable information for them. Now, there's a second group that kind of falls in it, and you'll see it advertised as with the acronym HIM, and it's Health Information Management. And it's a practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care, businesses, science and technology. And so it's just a long, drawn out definition for individuals that typically are working in the provider space more so than on the health plan space or the payer space, typically working in the provider space. And a lot of the advertisements for these HIM individuals or the health information management professionals, you'll see them that they're in hospitals, hospital systems, or large provider groups. And they are typically in the provider space, hospitals, providers, and also in some ancillary type spaces. They spend a lot of their time looking at electronic medical records and electronic health records, and they drive the complete continuum of care. So that's what they're looking for. They're trying to take Mrs. Smith when she comes into say Mrs. Smith comes into her primary care doctor's office, and primary care doctor sends her to an orthopod for a consultation. The orthopod looks at Mrs. Smith's hip pain and decides that Mrs. Smith needs to go into the hospital or an outpatient surgery center, depending on um, the level of issue with her hip pain, and decides she needs maybe a total hip replacement. And so HIM professionals are going to be in there. They're going to be trying to track and trying to help manage that or provide information that helps manage that total continuum of care for Mrs. Smith. Again, HIM, health information management positions, are typically on the provider side of the house. And then you've got HIT, and HIT can be as the health informatics analyst or professionals can be either on the provider side, or they can be on the payer side, or they can be on the government side. They are in charge within HIT as health information technology. They're the pocket protectors in the back room that are actually processing, storage, and exchange of health information in an electronic environment. So they are actually they're the I guess you could call them network administrators, or they are the information warehouse managers. They are managing the storage of that information. Uh, they help improve quality of healthcare. They prevent medical errors. They reduce healthcare costs. They increase administrative efficiencies. They certainly decrease paperwork, and they expand access to affordable healthcare. Um, Most importantly, they build and maintain information systems. So these are the techies that are working to ensure that the information that comes in the door to be stored in the warehouse is transformed from the raw data into the information warehouse that um, health information analysts, that HIM on the provider side will be able to go into that information warehouse, extract that data, turn it into information, and help either providers, payers, or the government improve their decision-making ability. And then lastly, you've got a group that I'm going to categorize as business analysts. So they are identify business areas that can be improved to increase productivity and strengthen business processes. They guide improving processes, products, services, software through data analysis, and they straddle a fine line between IT and business using data analytics. So, to me, a business analyst, if they're working on the health plan side, they're going to be the analysts that are working more on the finance side of the house, or they're going to be on what they call the front end side of the house, which falls under operations. They may be doing work on call center. They may be trying to figure out what's the key performance indicator for the call center. So maybe not, they're working in the healthcare environment. And again, they can be working on the provider side too, trying to improve efficiency and a flow of process in a provider's office, or, definitely in a hospital, because man, they need it. They need help on the process side. But rather than providing information that's impacting the diagnosis, treatment, the clinical aspect of healthcare, or the financial aspect of healthcare, maybe through fraud, waste, and abuse detection, or some of those areas, they're functioning more in the operational side. And again, operational, claims adjudication, or adjudication just means processing. So claims processing side of a health plan, they're working on customer service, both on the provider side and on the health plan side. Again, operational mail rooms, those type things, operational type activities, or working in a finance department, or a collection department, or a billing department. Those to me are more business analysts. Health informatics plays a role in collecting, storing, organizing, and most importantly, analyzing data to benefit patients, clinicians, payers, and public health. And again, I'm piecemealing this information from information I've grabbed out on the internet, from textbooks I've used in the past. I did load a health informatics, again, free textbook for you out there on on Canvas website, so you can grab it. It's more geared toward the provider side of the house, but again, you see a lot of analytics or a lot of analysts flipping from both the payer side to the provider side, and they're constantly flipping. They work on one side for a while, and they'll take that information, go to say they're working on the health plan side. They're gathering information, understanding how the health plan works, and they'll flip to the provider side, or vice versa. So, just because the textbook is probably more geared to the provider side, it still has a lot of information that you can use either on the payer side or on the provider side. When you're talking about health informatics, and again, we've talked about it lowers healthcare cost, decreases, again, and a really important, decreases fraud, errors, financial losses, delayed patient care, and especially when you're talking about providers, you see a lot of health informatics when it comes to calculating no-shows as a provider-based practice issue, and it impacts patient care because no-shows, even though a lot of healthcare providers have started charging now for no-shows, so you have to call them, let them know 24 hours ahead of time you're not going to show for your appointment. And they go ahead and charge you, maybe they charge you $50 or $75. It depends on the particular provider, but no-shows are an extremely inefficient impact on the workflow process of a provider group or a provider's office. When you're talking about healthcare on the payer side, fraud, waste, and abuse, it is a huge issue in healthcare. CMS, you'll see numbers, according to, fraud, waste, and abuse, you'll see numbers, 7 to 10% of the total healthcare spend in the United States is because of fraud, waste, and abuse. My experience working with health plans, it's probably closer to 15%. It is a significant impact. And when you're talking about health informatics, it goes a long way to controlling fraud, waste, and abuse through payment integrity and just errors in data processing, errors in claim system. And healthcare on the payer side, network management individuals who are trying to negotiate with providers, and it's as big an issue with providers as it is on the health plan side. When they're negotiating contracts, they try to get too cute, they try to get too creative, they try to negotiate terms that no claims adjudication system can process accurately. They don't understand that the contracts they're negotiating, it is just extremely difficult to adjudicate those claims accurately. Let me see if I missed anything. Also, health informatics reduces error rate by streamlining and automating administrative tasks. Think about 20 years ago, you'd go into your doctor's office and there was he's sitting there with his, or she's sitting there with the clipboard making notes, and that clipboard's handed off to a coder, and that coder goes to the business. I mean, it's just a paper shuffling manual process, and it just incorporated human error. Now with this electronic health record, there's still opportunity for human error, but it's been significantly decreased because the electronic health record does a lot of the work for the healthcare provider. Also, it reduces the errors in process billing code, verifying insurance information. Just the verification of a member's healthcare contract. So the contract that the employer group has bought from the health plan and provides to their member, that has to be validated before that, at least hopefully before you go into the doctor's office, or at least before you see the physician, and it's going to be verified that the healthcare claim won't pay accurately. And it also, reduces medication errors. So just the automation or health informatics has gone a long way in just reducing overall errors. Data analytics, it constitutes the core of health informatics. You've got things like it's improving diagnosis, improving treatments, and it's certainly improving preventive care because you're taking large chunks of information, big data, bringing them together, and it goes a long way to identifying those preventive care opportunities that are going to maximize a person's health status over the long run. It identifies patients with high risk. It increases proper assessments and treatments before more severe issues develop. And again, we're going back to preventive care. It improves the quality of care, reduces medical errors, streamlines workflow. Health informatics also reduces the length of stays in hospitals. And they do this by early detection of risk can mitigate the number of hospitals admissions, and not only the number of admissions, but it can mitigate the length of stay for any given patient. It accesses real-time patient records and medical treatments. It drives critical decision-making to deliver best patient care. Again, health informatics is driving all of these processes. It is completely streamlined over the years or over the time period or over the most recent time period. It has streamlined the efficiency and the accuracy that healthcare goods and services are provided to a consuming population. It empowers patients, or at least it should empower patients. It should make patients more customer-centric when it comes to the receiving healthcare goods and services. Think about telehealth and telemedicine. It allows for non-emergency appointments with providers via the internet or via Zoom. You can provide services to more patients, and it has really expanded or really exploded since early 2020 with the issues that we have with COVID. It empowers patients by patients with think about the limited mobility or unreliable transportation or limited access to providers. Telemedicine and telehealth has really expanded the capabilities of providing health care or healthcare goods and services to a larger number of people. It empowers people by getting real-time access to health records and information via the computer and mobile device. My wife and I are both with Piedmont Health System here in Atlanta, and we can access our medical information, through the laptop, through an iPad, with your iPhone, and you are. Before I go in to see her, before she goes in to see her doctor, you're going in and you're filling out information on the internet so that when you walk into that doctor's office, all you're doing is paying your copay and you're ready to go and see the doctor. They're digital versions of the health card that you can get your latest healthcare data. And a lot of health plans even have a chat forum that you can go in and you can chat through their interface, and you can actually be triaged by a nurse if you want to. You can tell them what your symptoms are, and they'll say, well, you can get this taken care of by going to telemedicine, or you can go to urgent care, or you can come see the doctor, or you can go to the emergency room through that chat function. They're going to give you different alternatives, and then you as a patient, based on the financial burden or the financial liability that is driven by the health plan or the benefit plan that your employer group purchased, you can make decisions on how you want to go about receiving your healthcare goods and services. Most of my prescriptions, or most of my wife and my prescriptions both, we get at Costco and call in. Costco fills the prescriptions. We get a text from Costco and they said, here's your prescription, it's ready to be picked up. Here's how much it's going to cost you. And at that point, I can go into Costco's website. Because Costco is going to process it based on the benefit plan that my insurance company has or my employer group has. So let's say my insurance plan processes my prescription and it's $50. I can go into Costco system, and if I see it on Costco system and it's $40, or I can go into some of these little, drawing a blank on the name right now, but some of these little like RX applications you get on your cell phone, I can price it there, and I may come up with $39. I can take that information on my cell phone. I can call Costco and I said, your the health plans charge me $50, your discount's 40, yours is $40, and my uh, prescription application on the phone says 39, and Costco will rebill it. And when I go to pick it up, I just have to show them the application on my cell phone, and I get the drug for $39. So that's what you're seeing now, especially being driven by these individuals with, again, I make fun of them because, I'm, yeah, as an economist, I can make fun of accountants and, the geeks in the back room that are doing the coding, because we're all pretty much in the same boat. We're all analytical. We don't have a whole lot of personality, maybe, but we're still driving improvements, and that's what you've got with all of these HIT guys in a back room somewhere. They are doing the programming, and they're helping drive healthcare forward. When I think about and I'm just going to go from the health plan side here. So if I'm thinking about business analyst, I'm thinking about health informatics analyst, and I'm thinking about health information technology analyst, and we'll take the HIT group first. I usually think of them in a health plan. They'll show up like in privacy, they'll show up in IT, they may show up in legal, they may show up in HR. The health informatics side, I think more along the lines they're showing up in medical management, network management, internal audit, payment integrity, operations, legal to some extent, actuary side of the house, management of the third-party vendors. And if you're thinking about, business analysts, they typically you'll see those in sales, membership, enrollment, some levels of operations, finance, because on the finance side of the house, there's always federal reports, that are mandated that you have to produce. And depending on the state you're in, there could be a multitude of state healthcare reports that you have to generate. You see them typically in strategic planning, and you see them typically in competitive intelligence. So if you're working on, and that's just kind of my expertise or my experience in the health plan world, that's kind of where these kind of consolidate. And, it really, when it comes to health informatics, it doesn't necessarily align with the infrastructure reporting swim lanes in a whether it's in a payer's office or payer organization or on the provider side. You can have these individuals, they can be multi-talented, and they can cross from one swim lane to the next pretty easy once they get either on the payer side or on the provider side, or again, flipping back and forth between payers and providers. Let's see, we've got a couple of things here. I'm going to talk about the emerging trends. So health, they talk about emerging trends. You see it on some of the talking heads on Fox and on CNN, but they refer to it as health data interoperability. So you've got exchanges, you've got access, you've got integrating data. Electronic health record has been one of the main drivers. Information should be seamlessly. Not always happens. There's sometimes communication issues, but there should be this interoperability, should be improving the efficiency in the exchange of data, the access to data, and the integration of data. When you're talking about the goal of interoperability or emerging trends, you're talking about, improve case coordination, improve patient outcomes, um, and you're trying to reduce costs. So um, the more the more access your provider has to up-to-date healthcare information on you, the patient, in theory, the more effective that treatment plan should be, and it should come at a lower cost. And then another emerging trend and they're talking about artificial intelligence on the television nonstop, and artificial intelligence driving a lot of the financial sectors. And if you paid attention to the financial sectors um, let's say over the last month, they've really been booming. And then a lot of it's being driven by the perception that intelligence is going to really drive profit margins going forward, because it's going to make companies make the operational processes more efficient, and in theory reduce cost. And in reducing cost, in theory, you can increase profits. And under artificial intelligence, you've also got machine learning. And then to me, when they talk about machine learning, it's just machines learning from the data. Also, to me, it's more like structured linear regression. It's something that's been around for a while. It's not revolutionary, but it's come to the forefront over the last few years, and it's going to continue to expand. Because what you're doing, you're replacing repetitive processes or manual processes. Healthcare is complex, accuracy is critical, and you're increasing access to appropriate care. And an example that I read about on the internet, talking about, healthcare is extremely complex, and they were talking about palliative care. So you're down toward the end of life, and you're wanting to take access or to access palliative care, and AI is actually helping to improve the kind of I'm going to call it the sweet spot, trying to improve that point in time when it is most important for a patient to enter palliative care. So you see just a lot of information out there with respect to AI, and how AI is driving, and how health informatics through artificial intelligence and machine learning are going to drive the future of healthcare. And then another emerging trend, you're talking about data analytics, and you're trying to shift, or at least providers are theoretically trying to shift from treat and rehabilitate to kind of the early onset, or the identification of the early onset of issues that their patients are being exposed to. They're promoting overall well-being with prevention before cure mindset. And again, it goes back to managing your health status. We're all born, again, with a certain level of health status. And if we don't take care of that health status and improve it or try to manage it, it's going to start deteriorating at a much younger age than it normally would. It's driven by health information, data science, and computational modeling. So that's the data analytics. So you've got interoperability, you've got artificial intelligence, business learning, artificial intelligence, machine learning, and you've got data analytics. So those are three emerging trends that are really starting to expand and really starting to drive healthcare in the future. And it's all being driven by health informatics. Data, and I've got a couple of blurbs here, and just want to talk about data science in healthcare. And I've had students in the past had a little difficulty in grasping or getting their arms around, what data scientist means, or what a data scientist is, what a data scientist does. And at least in the definitions that I can find on the internet by Googling, data science in healthcare uses scientific methods, statistics, informatics, and machine learning to analyze and interpret large amounts of healthcare data. The goal is to improve patient care outcomes, experiences, as well as to optimize drug development, disease detection, and resource allocation. Identify patterns and make predictions that would be impossible to detect with other methods. Sound familiar? Sound just like health informatics. That's what health informatics is doing. But if you listen to the kind of the definitions as I read down through them, data science or a data scientist almost sounds like a health informatics professional on steroids. So I think you're seeing a lot of individuals that have been functioning in the health informatics space. Now they all want to be, as I said earlier, they all want to be data scientists because that is the hot buzzword. That is where they think the money is, and that's where the healthcare analytical side of the house appears to be moving. So that's kind of the 10 cents about data scientists or data science in healthcare. And when you think about just again, going back to individuals that focus in health informatics in one way or another, health informatics professionals, they can work on the provider side, or they can work in provider associations, organizations, American Medical Association, American Hospital Association. Most states have some type of provider association that lobbies for changes in reimbursement and management protocols for providers in a given state. You've got payers. Again, work for health plans. You can work for health plan associations, public health. You can go work for CMS. You can work for NIH, those type of institutions. Consulting, you've got payment integrity consulting, actuarial firms. You've got revenue cycle management on the provider side type firms. And there are just other fragmented opportunities out there. But again, the opportunities from a background in health informatics are widespread, very lucrative from a payment perspective, and it's an opportunity to move into the healthcare arena or the healthcare space as an alternative to working in the healthcare space in a clinical profession or a clinical nature. And I think that is all I've got for health informatics. That's going to wind up this module. And again, the next time we get together, we're going to roll up our sleeves and we're going to get into the coding aspect, at least at a high level. I'm not going to teach you how to code a healthcare claim. I'm not going to teach you how to be a certified professional coder or an RHIT or an RHIA, but I'm going to give you a high-level view and a high-level understanding of codes and what the codes are used for. And then we're going to take that information in the succeeding models or the subsequent models, talk about just the information and the practicality of how a medical claim is built, how a hospital claim is built. We'll get into some big data. We're going to talk about information, warehousing and repositories. But the next module, and again, the next time we get together, we will talk about just the coding fundamentals and how coding fundamentals not only drive access to patient care, but how they drive the reimbursement to providers and and of course the requisite expenditures on the health plan side. So talk to everybody soon.